Hello, we are Group 7, Reham Shalaby, Jae Hyun Bae, and Chanyeong Jeong1. And the title of this presentation is Prevention of COVID-202X. The contents of our presentation will follow introduction to COVID-202X, protective measures, rules of government to control spread of virus, and conclusion. As you know, the virus SARS-CoV-2, COVID-19, is spreading to the whole world and still actively infects us. If the severity of COVID-19 gets worse, acute respiratory disease occurs and the infected may die. Although the aggressive spread of SARS-CoV-2 is weak temporarily, another critical virus can show up our society. Even the same SARS-CoV-2 can be spread again until the invention of the SARS-CoV-2 vaccine. For current COVID-19, the transmission of virus happens through droplet infection that is mainly caused by sneeze or close talking. An infected person gets flu-like symptoms, and increased number of sneezes make more spread chance to other normal people. To reduce spread of the future COVID-202X, we need protective measures in terms of individual levels and social levels.
Hi all, I will talk about protective measures of COVID-202X. As COVID-202X is new virus, so the ways of transmission is not completely clear yet, and it may have new mutations, so not completely understood. So you can assume like everyone encounter might be infected and contagious. So knowing how SARS-CoV-2 and COVID-19 spread enable rational countermeasures. Here's the expected ways of spread, direct way and indirect way. Direct way by airborne droplets from infected person through coughing, sneezing, and close contact, even with talks. And indirect way, touching in contaminated surface, then touch your face or nose. And here is the guidelines to avoid spread of COVID-202X. So you should maintain like enough spacing between you and everyone you meet, like at least 1 meter, and you have to follow the guidelines to wash your hand properly with water and soap and or even with alcohol. And when you are sneezing or coughing, you should discard your spoiled tissue in closed can and cover your nose and mouth with your elbow, like this way when you are coughing or sneezing. And if you have any symptoms, just wear your protective mask and go immediately to seek medical advice. And if you will develop any symptoms of coughing, sneezing, or any respiratory symptoms, you should immediately go to healthcare center. And when you are at home or outside in public places, avoid touching your nose. And finally, the vaccine will be the most effective prophylactic measure to avoid spread of COVID-202X.
Hi, I'm Jae Hyun, and I'll present of the role of the government. The government should be arranged for the quarantine system, enhancing diagnosis, and we have to analyze how they spread and we can make some plans for more specific and faster. The government should make some guidelines after that to prevent the spread of disease, but should delete the meaningless or unobservable rules. Since if we make the guidelines, then the citizens won't follow that, then it will be meaningless. So we have to minimize the inconvenience of citizens. And the most important thing is that the government and also citizens have to cooperate each other. So the role of the government needed the suppression of the disease to entry and the spread. So they have to track the patients and notification of the guideline for the prevention. And we have to control the hospitals. So we have to utilization of the healthcare institutions. So securing and predicting hospital infrastructure. And we can calculate how it will be safe or not. And we also care of the patient treatment and the management. Since if the patient is like the out of order of the hospital, then we'll be the make a big breakout. So we have to make the fast and efficient update information of the treatment. And as I always say, the cooperation with the parent government and the public communication is needed. So even governments try to control everything, but they can't control everything. So also citizen or and government need cooperate each other and follow the guidelines. So the conclusion is like we have when the new COVID-2 breakout has come out, then we have to prevent the pandemic. We need to know how they spread and where they spread from. And the citizens should keep update information guideline, and both government and the citizen must cooperate to fight with disease. Then I'll give you a question for you. What is the most important thing in the pandemic? And also, what is the most dangerous thing in the pandemic? As you know, it is you. So the important thing is you have to save your life first, and also you have to save others' lives important. So we have to cooperate each other and try to follow the guideline, and then we can fight with the disease. So those are the reference I read it, and thank you for watching.